I was in desperate need when I came to UK. In 1998, I'd had a heart attack, had open heart surgery, and I had lost my job because they said I was disabled. I wasn't able to work anymore, so they took my job away from me. Didn't have any medical insurance that would cover the medications and so forth they had me on. I came asking. The Lord said, "Asking you shall receive." So I came to UK. That's the first time I was told about a friend who UK had helped, and I came asking them. And so they reached out to me. They were a family that reached out to me.
All of the programs that are developed here at the Center for Rural Health, whether they're just here at the center or whether they're community-based or we work with different entities, they're all about the people we serve. The poorest of the poor receive the services here. And that doesn't mean that the rich of the rich doesn't get care too, but most programs that we develop here at the center really help our communities across the state.
I think the people who work at the center are really special people. They're very knowledgeable about rural health care and the problems of rural Kentucky. The patients really benefit, hopefully, in the long run, but hopefully also the people that we educate that go into these different professions will benefit from the programs there.
The University of Kentucky Center for Excellence in Rural Health in Hazard, Kentucky has served the rural communities of the Commonwealth for over 20 years. In that time, the center has grown and expanded, paving the way for better health care for areas of the state that needed it the most. It has expanded the education in this area, helping to create the future healthcare professionals that will care for these communities in the coming years. The programs available for the students and the community that the center provides will ensure that the rural areas of Kentucky will receive the best that healthcare has to offer. The UK Center for Excellence in Rural Health was established in 1990 to address health disparities in rural Kentucky, including a chronic shortage of health professionals and residents' poor health status. The center accomplishes this through health professions education, health policy research, healthcare service, and community engagement. Although the center was established in 1990, the ideas of creating a center for rural health began much earlier.
I came to the University College of Medicine in 1980, and already at that time we were talking about doing a lot of things outside of Lexington, more in central, southern, eastern Kentucky, where most of our patient base and referral base happened to be at the time.
I remember there were a number of key people that were responsible for that. Tony Gates and I talked about this a long time ago, and I know at one point we were at a meeting. We used to have regular meetings with the University of Louisville College of Medicine, and we were at a meeting and we were talking about, should we become more involved in rural health care? And I think the University of Louisville wanted to be the urban institution. We were more interested in a statewide mission. And so we decided at that point that we would move ahead and try to become much more involved in rural health care and improving rural health care in Kentucky.
Senator Benny Ray Bailey started talking also about developing a program, and we had already changed from the old AHES to AHEC, Area Health Education Center program. So we had centers, fledgling centers started around the state, and one of those was in Hazard. Dr. Jim Lambert down there, Dr. Joe Florence, all of these people were very supportive of getting more of a UK presence. And finally Senator Bailey was able to pass his omnibus health bill, and an integral part of that was the establishment of the Center for Excellence in Rural Health in Hazard by the University of Kentucky.
Believe it or not, it passed without dissent in the House and the Senate. Now, I don't ever remember a bill this large passing without dissent. 138 votes for and none against. So So it was a popular bill, but as a major component of that bill was the Center for Rural Health and the funding that went into it. And a lot of people asked at the time, why is the center located in Hazard? Why isn't it at UK or in Lexington or some other, Frankfort, for example? And the answer to that is because that's where Senator Bailey wanted it. And so that's why the center is in Hazard. But I think probably one of the early challenges for the center was that that people thought it was a center for Eastern Kentucky. So the challenge was to make it more of a center that had a statewide influence.
At that time, there was not a lot of educational opportunities for students other than the community college level to go on and to complete their degree. So it was really important for people that lived in the mountains to be able to go to college and to get a higher degree.
It's certainly been a boon to Hazard. You know, obviously it employs a lot of people. It turns out a lot of people who end up working in health care locally, they spend money. That money gets turned over several times in the community. And you know, when we put a family practitioner out, that family practitioner creates a lot of jobs.
The first of the major programs that was developed at the center was one that focused on what the rural communities needed most. In its first 20 years, the Family Medicine Residency has graduated 61 residents, with approximately 70% still practicing in rural areas.
One of the first things that happened here at the center was to develop the residency program. And with that, if you could think the concept through, if you train people in rural areas, they will stay in rural areas to provide care. And that was done because of the healthcare shortage that we had of providers at the time. Trying to get physicians to realize that they needed to stay in rural areas to provide care. It took a little while to become successful here at the center, to get faculty hired and to get residents into the program. And you know, it started out with 1 and then up to 4, and now we have 3 cohorts of residents, as well as medical students that come, as well as nurse practitioners that want to do their clinical here. We have master students in nursing that wants to do their clinicals here. We have PAs that want to do their clinicals here. So have come a long way from the center.
The UK North Fork Valley Community Health Centre, the residency's model clinic, emphasizes quality of care in an environment that provides multidisciplinary education to family medicine residents, medical students, nurse practitioner students, and other healthcare professionals.
The clinic within the center provides services to, as a federally qualified health center, provides medical services to people regardless of ability to pay. So people without insurance and without a lot of money are still able to get medical services here, which include family medicine, pediatric care, OBGYN related medical issues, dentistry, pharmacy, and discounted medications. We do a home visit program, so we go out to people who can't get to the clinic easily for transportation issues, or they're homebound for medical issues, and are able to go see them in the home, treat them, also train our residents to be able to do that as well, so they can make that a part of their practice when they leave, if they choose to. One of the neat things is you find out a lot about people that you wouldn't in the clinic setting. You find out what their home life is like. You find out some of the conditions that they live in, that you might be able to try to find some resource for them in order to help get things fixed for them, and also understand a little bit more about the social issues that go along with their health care.
Particularly the patients without insurance, we're able to help them significantly and take care of their problems, and we're able to see them in the hospital and the clinic, and you get a lot better care if your same group of doctors are taking care of you no matter where you're being seen.
They seem surprised because we can actually see them. We don't turn them away based on their income. They come in, we give them as good as quality care as the person with insurance comes in. We treat them as equals, and they are very appreciative, and I don't think it could get any better.
And of course, the Family Medicine Residency program offered at the Center for Rural Health is ideal for students who are already planning on practicing in rural areas.
It was perfect for someone like me who knew I was going to always practice in a rural area, because you have to learn how to treat patients who live an hour away, but yet this is the closest place, and who are very poor sometimes. Sometimes they require a lot of counseling because they don't have the best understanding of all the issues, and a lot of TLC actually. And I was able to learn how to take care of these patients without insurance, with insurance, highly educated, not so educated, a lot of patients who are just like my family members.
However, the UK Centre for Excellence in Rural Health doesn't simply provide healthcare. It also fosters the innovation to drive the healthcare system forward by offering education for those seeking employment in the healthcare field.
Education is a true focus here at the Center for Rural Health. What we would like to do is to have students that ordinarily would not be able to finish their education for higher learning, would not be able to go to the University of Kentucky to finish their degree, to be able to have a place to do that.
A lot of our just plain academic programs went very well. Physical therapy got a quick start. One of the more successful programs was the ADN to MSN nursing program. One of the key problems in Eastern Kentucky at the time was a lack of master's trained nurses to take over administrative part of the nursing programs in various hospitals. And in a very short period of time, we were able to really put out a lot of folks who had a master's degree in nursing, and so the hospitals were able to hire local people then who were more likely to stay with them for a long period of time.
Working during the day, it was kind of impossible to go out of the region to get that degree. So without it being offered here at the Center for Rural Health, I probably never would have got my master's. And I think that's really important for a lot of other people. We typically have non-traditional students who work all day, have families, so this is probably the only opportunity they would have to pursue that degree.
Allied health majors are always in high demand and offer diverse opportunities for success. Hazard Community and Technical College's Allied Health Division is housed within the UK Centre for Excellence in Rural Health. This division includes academic programming in diagnostic medical sonography, nursing integrated program, physical therapist assistant, radiography, and surgical technology. Sue Riddle is a faculty member for the nursing integrated program.
Some of these students, if we didn't have a program here, would be unable to further their education because they wouldn't have the funds necessary. They wouldn't, they have families here. They couldn't travel to Lexington or Huntington or other areas to get their degree. So our students are always able to get jobs in this area. With the nursing, radiography, surgical tech, PTA, I don't think there's any of them that really have a difficulty in getting a job once they graduate. So that is wonderful for the economy, for the community, as well as for the student and their families.
The wide variety of available educational programs at the Center for Rural Health provide students the opportunity to pursue careers in the field of their choice. One particular field that was in desperate need in rural communities was physical therapy.
It's been very difficult to fulfill all the needs in the state of Kentucky in the rural communities with physical therapy, and this program here has really began to meet that need over the last 20 years. People are having a much easier time finding physical therapists to work in these small communities. In the end, it's the community, because we provide them with practitioners with the skills that years ago were only found in larger communities. So in the end, it's the community members here that end up having to have the physical therapy services or healthcare services in all the other areas that the center impacts. That's really the big winner.
Another rising field at the center is the Masters of Social Work degree.
I think our students, being non-traditional, having an experience coming into the program, have identified issues that they want to make improvements in. They want to help people through, or they want to bring additional resources and services. So they come in wanting this degree in order to help the people that they're working with. So I think it really is kind of a win-win for the student and for the community.
Overall, the center is responsible for training exceptional students that can truly provide for the rural communities that need their expertise the most. Prior to her role as faculty with Hazard Community and Technical College, Sue Riddle was a former graduate of the UK Centre for Excellence in Rural Health's Master of Science in Nursing program.
I think that if you have students from this area that work in this area, that they probably know the needs of their community maybe a little bit better than those that are not from this area, and that would contribute to better health care.
We have the best and the brightest here. If you look at our graduates, we have a wonderful physical therapy program, a doctoral program for them, and I feel like when selection comes, we have the brightest students here at the Center for Rural Health. Our social work students, which we still have a shortage of social workers across the state, we get the best and the brightest from the mountains here that need their education.
The center also serves as a research outlet for the University of Kentucky, discovering what healthcare needs are most prevalent in the rural areas.
Rural Kentucky has numerous health disparities. We have a chronic shortage of physicians and other types of healthcare providers, and we have a lot of health disparities with regard to high disease rates, problems having access to health care. So that combination of factors creates a ripe environment for doing healthcare research. So we do studies on how can our healthcare delivery system be improved to be more efficient in order to see more patients.
In addition, the center offers the Health Career Summer Enrichment Camp, which introduces incoming freshmen and sophomore high school students to a variety of health careers.
We've got our educational programs, but we wanted to reach deeper down into a younger set of students to try to address that. So we created the Health Career Camp. It's for rising 9th and 10th grade students within the 6-county area. And we've had amazing success with that program. We've had 4 years of the camp so far, about 120 participants. And we did a study to see, of the participants that have gone through the program, what rate of those students plan to seek a health career. And we found that about 70% of them do. So we think that's a pretty good rate of success.
As the center grew, it began to offer many other successful programs for the community, leading to one of its greatest successes.
Well, I think the development of Kentucky Home Place was one. That started in 1994, and I actually got to direct that program for a while and see the good that it did for the people that ordinarily would not get services. And this was across the state. It was developed here at the center, and we were able to expand it across the state to other rural areas. And so people that normally would not have access to health care was now getting access to health care and access to prevention, the medication that they needed, the supplies that they needed. So about 15,000 people a year receive services still through that program.
Despite all of the efforts of the center, it still has to face the growing economic concerns of serving rural areas which, historically, have lower socioeconomic status than their urban counterparts.
Every time there's a layoff in one county, you have more people that need access to services that do not have insurance. In some of the areas that we serve, we have the highest rates of uninsured populations there are in the nation.
And the response to the Kentucky Home Place program has been incredible.
Since I've been in Kentucky, this is the first program that I can remember, and I think the only program that is designed to help my family and other people in Wolfe County in the community with their medicine, for their medical care, okay? It's certainly been a great program. We've been very fortunate to be able to get the medication that we need without costing an arm and a leg. And as you know today, medication is really high. And this would depend on whether or not we could buy a month's supply of medicine, or we would have to maybe prolong one of our bills, electric bill, phone bill, maybe going to the doctor, maybe going to an eye doctor, or whatever other things that we would have to do. What was really great is to have someone to come into your home with a program like Kentucky Home Place and say to you, tell me what you need and tell me how I can help you. And you talk about a relief and a good feeling.
Access is better, and with Home Place still helping people get access. And sometimes it's not a matter of having a doctor or somebody available. It's financial access and other things. So Home Place has helped with that. The center helps with that. Having more practitioners out there helps with that.
Robert, a resident of Harlan County, is one of the many people who were touched by the center's former Southeast Kentucky Community Access Program, SkyCap.
Therese Taggart has helped me a lot. She showed me what SkyCap could help me do, and a lot of it was things that was here that I didn't even know about. Myself, well, it's really hard for me to tell people, but I can't read or write no more than my name. And like I say, it's really hard for me to let people know about that because all my life I've never had to till I got hurt. But the condition I was living in, was really, really bad. I really don't know where I would be or if I would be right now. Like I say, it's hard to put in words. But I just want to thank everybody that helped me.
The UK Center for Excellence in Rural Health, the designated Kentucky Office of Rural Health, has helped provide the local communities with better access to health care and has been able to benefit hospitals like Markham and Wallace Memorial Hospital in Irvine, Kentucky, with revitalization efforts by helping develop them into a critical access hospital.
Well, the Critical Access Hospital program was new to Kentucky in about 2000, and our hospital itself was struggling prior to Critical Access Hospital legislation coming to Kentucky. And we knew that it was coming, and we knew that for survival of our hospital, we wanted to be this critical access hospital, but we just really didn't know how we were going to do it. And we were so fortunate to be the first hospital to be licensed as a critical access hospital. And the reason that we were the first, because we had the assistance of the FLEX program and the assistance from the Rural Health Center. Larry Allen and Woody Dunn came in, and they really just started from A to Z, and we went through everything and said, okay, this is how you do it. And I don't think that it would have been as an easy of a process for us to have converted.
This conversion has allowed Markham and Wallace to expand its programs and has recently been certified to be the first Level 4 trauma center in the state of Kentucky. In these rural communities, it's often the economic pressures that dictate the need for health care.
We are in an area where we have a lot of people who don't have insurance and don't have the income that supports them going to other clinics or getting services if we didn't exist. So it provides those services for them and improves the health of adults as well as their children, friends and family, and also provides the training for the residents so that they are able to take that with them when they leave here and have a perspective of helping out those who need it.
I think a lot of our people were done without. It's either medication or food. And I think they would chosen food over the medication, and diseases we may have not lived as long as what we have. It's wonderful to come to a little small town like we have here in Hazard, Kentucky, rather than having to go to the big city of Lexington, Kentucky, 2.5 hours away. Now we have it right at home. You know, it's good to know that when we drive 50, it's easier to drive 15 or 20 miles than it is to drive 150 miles to get help. You know, we know help's available now.
The center has recognized the healthcare problems that face the communities in rural Kentucky, and its staff continues diligently searching for solutions.
It increases the visibility of rural Kentucky and the problems in rural Kentucky. And so, as some people say, if the problem is in the community or the problems in rural Kentucky, the solution's in rural Kentucky. So that's really what we'd like to see happen there, is that the center take on many of these healthcare issues for rural Kentucky.
We're a compassionate group just by nature. You know, we're hands-on people. We like to impact people's daily lives.
The Center for Rural Health in Hazard has certainly had a statewide presence, but we are also trying to expand the concept into other areas. For example, we now have not only the center in Hazard, but we have rural health centers in Moorhead and Danville and Madisonville and Murray. So we're trying to create more of a statewide presence for the Center for Rural Health.
With all this success, the future of the UK Centre for Excellence in Rural Health is bright. As the first 20 years comes to a close, the staff of the centre has great ambitions for the next 20 and beyond.
With the University of Kentucky's focus on community-based research, we are a rural entity. We're located in a rural location. So in my mind, we're in a prime location to be one of the leading participants in that community-based research.
I'd like to see it just continue to grow. All the educational programs continue to grow and expand outside of their walls. More educational programs come in, and our clinic continue to expand to the point that we actually need to build on and continue building on to the facility in order to meet our mission.
Expanding the influence of the center, I'd like for the governor and the legislature to call upon the Center for Rural Health for answers to questions that it might have. There are programs at the center, for example, Kentucky Home Place. That program alone costs the state about $1.9 million each year. Last year, they generated $26 million in health care for patients that they take care of. So leveraging that state money into something that is really special for patients, that's what the center's all about.
I would hope that it would continue to be an excellent program, and I'm sure it will be. I think as long as UK is involved with it, it will have to be. And it's not just the new kid on the block anymore. It's fairly well established. It does need to expand even in Hazard. I think they need more space in Hazard. We certainly need more space or more funding in our other centers, the other centers for rural health that are established around the state.
The fact that we came here and we did something for the people we serve is how I would like our legacy to be. It's not about one, it's about all. And I've always said that if we can get the poorest of the poor healthy, that we'll all be healthy.
The center's dedication to the people of rural Kentucky, the next generation of healthcare professionals, and its outstanding programs are what makes the UK Centre for Excellence in Rural Health truly an exceptional institution.
I think the overall success of the center really stems from the fact that we have the University of Kentucky behind us. We are part of the University of Kentucky. We are part of the community that we serve. So we work as partners together. There's not success with just I or just a few of us. It takes all of us working together. So with the backing of the University of Kentucky, working with all of our different colleges to bring the best to a rural area, I think is a partnership that is really successful.